Hey, it's Coach Josh here, and today I want to cover an important topic. This is the issue of scar tissue. And today we're going to cover scar tissue, adhesions, trigger points around the hip. So this is something that you're going to see in runners, and I want to demystify what scar tissue even is and why these adhesions and trigger points appear, what to do in these different situations. I want to give a lot of context and clarity today, and we're also going to troubleshoot what you would do if you're somebody who is a very active person and you have a lot of trigger points in the hip complex today. So we'll start off with the idea about what trigger points are, what scar tissue is. These are terms that sometimes you'll get from a massage therapist, sometimes you'll get from a physical therapist, or maybe a naturopath, or somebody who is a movement specialist. We'll talk about issues like scar tissue, trigger points, and let's create a spectrum. Like a trigger point or an adhesion. These are parts of your muscle fibers that get stuck together. Typically, not always, but typically when a muscle is very, very taxed and it is a little bit weak. So in order to support the goal of the muscle, which is to stabilize the joint, the body creates an adhesion or a little piece of glue that prevents that joint from moving further out of homeostasis or out of a neutral position. Huge caveats on what that means for your body, but these trigger points will try to stabilize a joint that's a little bit unstable. So for us, what that means is usually you have a muscle that's weak compared to the job that's trying to do or assigned to do from the body. So you get these trigger points or adhesions that try to stabilize a joint, and then over time, those adhesions become calcified and they become frozen. Mineral deposits build up, metabolic debris builds up around that adhesion, and that creates a painful and very stiff, very rigid, sometimes tissue damaging element that can get labeled as a calcification, a piece of scar tissue. And these are all not scar like you've been sliced open by a surgical knife, but scar tissue in that this tissue is protecting a particular muscle or joint. So you've got this buildup, the spectrum of things that happen inside of a muscle. So when you go to move it, or you go to execute a drill, or you just go to live your life, and you feel like pain, irritation, stiffness in that area. So that's a very 10,000 foot view on scar tissue adhesions and what those things are. So how this shows up in our everyday life, how we apply that information is we feel an adhesion. So today we're going to talk about your hip complex, the muscles around your glutes, and this is something that you're going to see in people who are even very active, and specifically runners. Because running is an activity that is, even though it's lower body, taxing and very lower body dominant, you're really using your quads a lot, you're using your calves, but your glutes and your deep six, your hip external rotators, they're not actually that involved. So even though you're very active, you're not necessarily building strong hip musculature, and unless you're a long jumper or you're doing something that's very explosive, or a sprinter where you're hamstring dominant, most of the time you're going to be using your anterior chain. So the posterior chain is a little bit neglected. So what we have to do is we have to give some love to the posterior chain. So let's talk about anatomy for a second. So I'm gonna have my assistant come in, and go ahead and pause the video because that's like a break. For the purposes of this demonstration, this is my lovely assistant Ross. He's donated his glutes and hamstrings, his significant glutes and hamstrings to the cause. So we've got a little bit of irritation in the hip. We've got scar tissue buildup. We've got hip pain right about here. Well, these fibers, these glute medius fibers, the lateral fibers of the hip, they're deep six, your lateral rotators. They're tight, they're smaller, so they're going to be weak compared to the other muscles, especially like to the max or quads or any these big gross movers. So you've got some very important but very small muscles here in the hip complex. And because if you're a runner, you're building up so much strength and tension in the quads, you're not really countering that with anything. So what we're going to do today is we're going to we're going to do some tissue work, some myofascial release. We're going to do some direct counter pressure with lacrosse ball. And we're not trying to cause pain. We want a moderate amount of tension in here to soften up, to break up some of that tissue, to loosen up some of that tissue so that it can get good blood flow through. And once we've loosened up that tissue around the hip with a tool, whether it's a lacrosse ball, a tennis ball, or a fist, or the massage therapist's thumbs, whatever it may be, we're gonna then be able to get better recruitment, better activation, and more blood flow through there. Then we're gonna do a couple of exercises to strengthen and keep blood flow through that area. You do that every day, and within like a week or two, you're gonna start to notice your hips are gonna be stronger. You're gonna start to notice more stability in the hip, the sacroiliac joint. You're gonna feel a lot more powerful as you do your athletic activities. And by the way, the pain is going to go away. So we're going to demonstrate how to do those exercises and to do the release work and the relief work on the tissue directly here in a second. All right, so we're here and we're going to be rolling out the tissue on the side of the hip. So where? Well, here's my hip bone, and I'm going to do one hand width to the side, and maybe just a little bit more. Depends on you, the size of your glutes, but there's a lot of tissue that we're gonna get, but we're trying to target this half moon area right behind the hip bone. So here I am, I'm gonna find that spot, I'm gonna roll over to the side. Immediately, there's a lot of cranky tissue. So I'm not trying to cause pain. It's really easy to cause pain with a tough or strong implement here. So that's not what I'm trying to do. I want the pressure to be like a 5 or a 6 out of 10. So it should be significant. I should know where I'm at, but it shouldn't be painful. You can always back off. So use your arms to take less pressure. And when in doubt, just get a tennis ball, get a softer implement. So I'm gonna spend 45 seconds, maybe a minute, just rolling out that tissue. It's not gonna change that much the first time, but I've done this a few times. I can already feel that relaxing the IT band. I can feel the pressure change in my knee. Okay, so what Ross is gonna do is he's going to find his hip bone and he's gonna target about a hand width, maybe a little bit more outside of the hip bone, and he's going to prop himself up over the ball, and he's going to start with small circles and go into larger circles, slowly getting all of the tissue around that hip. Now, he's not trying to cause pain, he's not trying to cause any irritation. He wants to feel pressure that's consistent. Like again, a 5 or 6 out of 10. Shouldn't be very dramatic, shouldn't be painful. It should be a little bit relieving, it should feel good and cathartic. If it's too painful and you can't do this with a lacrosse ball, try a tennis ball to take some of that pressure off. You're looking for 45 to 60 seconds on each hit. And if it feels good, you can go ahead and keep doing it, but after about a minute, minute and a half, you're not gonna get too much more of a benefit because the tissue doesn't change all in one day. What you're really doing is you're softening it, you're also inflaming it a little bit, which has limited returns on what you're going to be able to accomplish. So Ross is going to do some clamshells for us, keeping his hip level, keeping his hip over the other hip. Good. He's keeping his heels squeezed together. He is, right, nicely done. He's doing a good job of just using the lateral fibers. He's going to do 10 of those, and then on the 10th one, he's going to stop, and he's going to start to internally rotate. So he's going to drag the heel up into the sky. Yep. Nice. That's very demanding. So it's going to be difficult to have pure authentic movement, which is perfectly fine. But what that is going to do is that's going to free up and expose that hip and femur to more movement that hasn't been doing lately. Good. He's going to do 10 reps of these using that mobility that we just purchased with that self-myofascial release that we did with the lacrosse ball. And then he's going to straighten his leg and he's going to do kicks. So once he's done 10 internal, external, he's going to do 10 sideline leg raises, touching his toe to the ground, dragging that heel behind the silhouette of his body, But again, he's not pointing the toe up into the air. He's not externally rotating. He's only using the range of motion he has for pure abduction, which is honestly not very much, 30 degrees at most, which is why this is such a demanding exercise to do it all. So now he's really strengthening, getting blood flow through those muscles that we just loosened up. He's gonna do 10 of those, and then he's gonna go into a rotational drill. He's gonna do toe taps and heel taps, touching the toe to the front, heel to the back. Now he is gonna open up that hip and rotate it, and he's gonna try and do his best to keep that as high as he can off the ground as he makes the transition from internal rotation to external rotation. If he does this every day, using the cross ball and then following it up with these drills, he's gonna slowly take the pressure off. That hip is gonna become more balanced. He's gonna be stronger, more athletic, more powerful, and most importantly, pain-free. So the bottom line is, you have tight hips, you have painful joints, a joint complex like the hip, you have scar tissue. Scar tissue is nothing to be afraid of. It's nothing you can't work your way out of and back from. You just have to be diligent, take your time, and apply common sense. If you need any help with that, any that's complicated, reach out to me, message me on Instagram, hit me up online. Happy to help you get out of pain and into performance and function. See you out there.